Hey guys, it's Jake here. Welcome to our psychiatry unit on anxiety, trauma, and stress disorders. We are going to be talking about anxiety and panic disorders first, and then we're going to talk about phobias, urge disorders, and trauma disorders, and we will finish up the unit by talking about our eating disorders. So please stay tuned and let's get busy. All right, guys, let's get busy talking about our anxiety and panic disorders. Let's start out by talking about generalized anxiety disorder, which is going to be characterized as patients who have excessive worry and stress that really infiltrates multiple areas of their lives and is usually triggered by the most minor of stimuli. So we have excessive worry and stress, multiple realms of life. Worry is out of proportion to minor stressors. So, an example of this may be someone who shows up to work 5 minutes late. That's a minor stressor. However, this 5 minute lateness amplifies into this extreme anxiety and stress for the rest of the day. So they're going to be really stressed out just from this minor inconvenience or this minor misstep. And this is going to be characterized by things like difficulty concentrating, fatigue, restlessness, insomnia, muscle tension, irritability. These are all signals and signs of people with generalized anxiety disorder. So let's say this person showed up for work 5 minutes late, and then they're like super tense in their shoulders and back all day. They have difficulty concentrating on their work. That is going to be someone who is prone, who may have generalized anxiety disorder. And how do we diagnose this? Diagnostic criteria are so important in psychiatry on step one. So let's talk about the difference between needing a time frame and a number of symptoms, because that's super important here. So we need greater than or equal to 3 symptoms most days for greater than or equal to 6 months. The exception of this being children who only need 1 symptom. And we talked about some of the symptoms like difficulty concentrating, fatigue, irritability, restlessness. These are going to be permeating basically every aspect of life, and they're going to be triggered by the smallest of insults. Our management here is going to be cognitive behavioral therapy first off, followed by SSRIs and SNRIs. Our second line therapies here are going to be buspirone, TCAs, and benzodiazepines. I want to take a moment to talk about buspirone's mechanism of action because this is a really niche area where we use this drug specifically for generalized anxiety disorder and not usually for a lot of other conditions. So our body naturally makes 5-HT and releases it into the synaptic cleft. Now, what buspirone does is it kind of mimics the formation of 5-HT, and it specifically targets 5-HT1A receptors. And that is the mechanism of action of how it helps people with generalized anxiety disorder. So that's something to have on your mind for testing. Let's move on to talk about panic disorder. This is going to differ from generalized anxiety disorder because generalized anxiety disorder is kind of this constant low level of anxiety and stress, also a little bit of mental and physical symptoms. However, panic disorder is going to be acute, rapid onset symptoms that are both mental and physical. So it's important to note that this happens in absence of a trigger. So people can just be going throughout their day, and then all of a sudden, they have this massive onset quickly of really intense symptoms. Let's talk about some of the more mental symptoms first, which are going to be things like intense fear, palpitations, depersonalization or derealization, and paresthesias. And then this can be accompanied by seemingly more corporal symptoms like shortness of breath, choking, chest pain, nausea, and abdominal pain. And it's important to note that these come on out of the blue, out of nowhere, and are very intense. Patients often describe the feeling that they are dying or that there's no hope. They have an overwhelming sense of doom or dread. Let's take a moment to highlight the diagnostic criteria in terms of timeline and symptoms. So it's going to be one or more panic attacks, followed by greater than or equal to 1 month of fear of another attack, fear of the consequences of these attacks, and behavioral changes related to the attacks. And I would say these 3 bullet points are really high yield because oftentimes a question will mention a patient who's having a classic panic attack, and they will go on to expand that the patient is saying, I'm super afraid I'm going to have another panic attack, or I'm really afraid that something bad is going to happen to me during a panic attack. Or they may be changing their behaviors in an effort to avoid future panic attacks. This is like a really high yield part of panic attack questions. So really pay attention to that. Let's talk a little bit about our management. In the acute setting, we're going to encourage patients to practice breathing exercises in an attempt to like re-centralize themselves and kind of cut the panic attack short. However, if that doesn't work, we can also step up to benzodiazepine therapy. However, this is concerning for addiction, and we don't want to go to pharmacologic therapy if we can handle it with non-pharmacologic options first. In terms of our long-term management of this condition, we're going to use cognitive behavioral therapy as well as SSRIs and SNRIs. So this is kind of like a dual arm therapy. We have our acute management and then we have our long-term management. Now, I want to take a moment to highlight some important things to differentiate generalized anxiety disorder from panic disorder. So, generalized anxiety disorder is like affecting multiple realms of life at kind of like a baseline level. So, you're kind of like always anxious, like every little thing kind of makes you worried or anxious. Whereas in panic disorder, it's recurrent and sudden. So, you'll kind of be living normally, and then all of a sudden, boom, you have a really intense panic attack in the absence of a trigger. And that's key that we mentioned absence of a trigger because that's going to separate panic disorder from things like PTSD or specific phobias, which we'll talk about later on in the unit. I also want to leave you guys with a little graph of time and intensity. So let's talk about our generalized anxiety disorder first. So let's say that we have like this kind of baseline level of anxiety. It might peak up a little bit when you're like late for work, or it may like peak up again when you get into a little argument with your wife or your kid. This is like the symptom profile in terms of time and intensity for someone with generalized anxiety disorder. Whereas someone with panic disorder is going to have a pretty low level of anxiety at baseline. And then, boom, they're going to just shoot up for no reason. It's just going to be out of the blue. They'll go back down to a normal baseline. They may fear future attacks. And then, boom, they have another really intense attack. This is like the difference in the timeline and the intensity levels of generalized anxiety disorder versus panic disorder. And I hope that this helps you get these questions right on test day.